Hey, you're here again. Oh, son. Oh, no, yeah. Right off the owl. The owls are pretty down on them. They're out running around. Hello, boys here. You hear me? Is there going to be a prayer? Hear me? Am I on already? Okay. Hi there, everybody. This is Jonathan Nez. We are in beautiful Shanto, Arizona. Make sure you can hear. And this is where it all started. That chapter house across the wash there. And then there's a wash. Remember, I think it was Mike Six Killer's question, how we tracked in mud into the chapter house to get chased out. Shanto Trading Post right here. And so we're coming to you live from Shanto, Arizona. Eli, do we have the Vice President on to start us off with the prayer?
No, sir. We have Dr. Fowler on.
Okay, let's do the prayer.
Thank you, Mr. President, Vice President, and all the listeners. Ado Kodoshin, Sodazini, Beata Disney, Chicago Shidne, Daisino Sain. Ado Koden Hajon Dole, Shamana Hassan, Yadishkit. Ado the Internet, Danosini, Danosade, Bashin Soko Conti, or Asibi, Hon Hitanahi, Kazanle. Ado Arnoldson, Ayani, Belashla, Ini, Lini, Dine. The Nebuchadnezzar Bakai Adon Hinain his now and Clodo let Nasco net Naja. Ashin Sokohon Ket Adon Lane hit seat Ajahom, the Hana Holiado let Ado Conti the Costoyat Ehin Dasne, he don't hit Sanja Winson, Chidi in the Neda no Sinico. Ado Anit a home, his now and Clodo let Nasco net Naja. Anit a hon hit in the end lini con hashin sako a creature a home patodilzen. A yo ini ni eben na johot a etozen. Ba anil into but bajo ba ini zendo bajo ba ati ne hon shaman hasan lini conde. Aro e ya hashin sako con his na has a hon hitan hinagan. Adon hinal tloshi da holon go hon. Aro e ya con he con that is on he honesh kishnas trango. Ado ni ho wandan ligo hon hitata ake yat ekon kitnada hastado le dan tsango hon da atingo da hon mutude da atson hon yode dan hosado hitas dan hosado le hon shmana asadlini ado oshin yugo e hon benike tozulzun la nan da hot e ben khana holyado le Ado kon hit a lot so dan lini kon to last chain ado to la hon dan lini nakabas da hon lodo le nakaba holiado le nakabach hon lodo le at hon shmana san lini hon ado kon twido san in lini hon yat eko hon nada kedole kombina antin lini kombizad lini kombizad betrado da nit endle edo hona khabet hon lodo len humasanin yiche ni human hijen hik e a tsohon laji case ni na rai a tehon benash ni dole aro ha shin sabokon ni hik e dan lini bila ashlai zel idanas da hon yat e das li dole hon betranda hon kazon hichin juno cheda has kedole kon shmana san lini aro kon kashin sabo kon belash la idenani denetan lini ho awalia de nazani go juno ho tunda des kezon juno hich beta isni do le shamana hasan lini kon aro chenen lini do ho yat ero nata auftra do le ho shamana hasan lini kon de yat ero nata hol ado le aro ho bata ultra in le ho aro alt kan hashin tsagonat ani la salate nat ani la hon sila aro shiyaj aro hon chief of staff da be da but ojiat hon nada kedole aro alt kan konde ne be kai hon dal ne shito yat hon nada kedole hala hashin tsagon hon chopa inzen la hon yat ho ani tsani tene hon belash la ini lenin kitna hon lodole ahon tsago e ahon tsade zendlini ahon shende be hanana si dole shamana hasan but a di ne ben hit hojana asli dole hojana asli Mr. President.
All right. Thank you, Dr. Fowler, for the prayer. I took off my mask. It's more than 6 feet from other people here. Wanted to give everybody an update. Again, we're in Shanto, Arizona, coming to you live from the canyon, and we're doing our last food and supply hygiene distribution, teaming up with CORE, also World Central Kitchen. We've got the Shanto Community Governance officials and staff. Also, we got Miss Navajo here, and the Office of the President, Vice President, Indian Health Service, NTUA, Choice Wireless, of course, the U.S. Census for those that want to get registered or self-respond. Was been a good turnout all this day today. We started out from Baadaway Gap and went up to Coppermine, Lachii, Kaibito, Tsapikin, Navajo Mountain, and now Shanto today. So, a lot of people were appreciative of the food and supply distributions, handing out healthy foods and hygiene kits for everybody that was able to come here. We had also people volunteer their own vehicle to get these food boxes or hygiene kits to some of the elders that don't have vehicles or people that don't have vehicles here. So I want to say thank you for many volunteers. So kuije kodoba anda huine ya di pusinskagi na states ata di na nigi no the nebike ya kaudo ashladin how zogo all over the world. She uta ya uta na ho a eroshin ako the Navajo Nation the nebike ya kao ya kodoba anda huine kuije din das kagi and any hinna the kosinskagi na states at das ka test of the ya hela be the hanodi na snigi hanigi egel test of the yagi ata nezat din do ba ta the mil yaj do ba naste nezat din do ba ashlati do ba naste net au eko nikeni hinna tested up the deal, yeah. Ado das Kado di ya Pusinskagi, Pedato Nagi, Nesna, the Milia Judoba, Naki, Nesna Dinova, na Kitsata. Ado, someone got stuck there in the sand. Ado di Nesna, the Milia Naki neza tindo ba naki tsata. Yitsa. Did it go off? Oh, we go. Okay. Ash. So said the miliage. Doba naki neza tindo ba this tindo ba naki net. Eko ayat and asli. Ado yitsa da jitengi kundi the kusinskagi beninagi ya ashla neza tindo ba ashla tindo ba asla net ku yikeni na yikena ako kudoshi ya kedan hengi batsu dolesh dosh the heard a beat. So I just want to let everybody know that over 103,959 people have been tested here on the Navajo Nation. And of those, 10,212 have tested positive, and 7,242 of those have recovered from COVID-19. And to this day, we have 551 people who have passed on from COVID-19. And so what we have seen is, okay, can I have some of you guys go over there and help out? There's a vehicle that's stuck over there. So from yesterday to today, we have a spike in cases of 42 new cases. And yesterday it was 27. And now today we got 42. And so that is the reason why we are putting a 57-hour curfew in place this weekend. We don't know how widespread this is. We're looking at the Sage Memorial Hospital Service area, which is a concern, and then the satellite chapters in Eastern Agency are a concern right now as well. And little tight fit here down in the canyon for our big trucks. So those are a continued concern for the Navajo Nation. And then we also have a concern in the Utah area, Red Mesa, in that region. As you may know, there are high spikes happening in Flagstaff, Coconino County area, as well as Utah. There's been an increase in Denver. So the increases are happening all around us, which is influencing our numbers. And we just want everybody to stay the course, wear your mask, social distance, wash your hands with soap and water, and use hand sanitizers, and of course, stay at home. The stay in home order is reinstated, and what we're saying is let's stay home as much as we can. If you're going to get essential food or supplies, please just send one person to the store to get supplies. So tomorrow on Friday at 8 p.m. will be the start of the 57-hour curfew, all the way to Monday at 5 a.m. And so that we can get our public health professionals caught up with contact tracing, because we need participation from people who have been in close proximity to these COVID cases. And it doesn't help if those individuals don't give us information about what's happening in those incidences. We need them to be forthcoming so that we can know how wide the spread is. The 57-hour curfew will give the public health professionals, the epidemiologists, some time to catch up so we can contain these spikes here on Navajo. So we are here handing out care packages to our citizens. We've been doing this for the past 3 weeks, which we're also including the U.S. Census to get counted. So we're asking for your help. I know people want to do what they're supposed to be doing, but this is very important. We want to save lives. Help us continue to keep that trend down. We can get past this spike. This is going to be everyday occurrences almost. We're going to get spikes here and there. We just don't have no vaccine. And so, adainos ne, chikiros ne, tudi azebaten, ado ahandin deska. Azebaten niki penina eshi, akut edo de. Tendel kito de, to yandel kito de. Ako ani spot. Ka nature do kitchen de nishude asho ya kut edo de tinas nigi. So oyo sab asana le ya. Ila bini yadi ze di azegin de kagin hikeni ina chin de kato de. Da no da yada tie. Tudi kuje zen indan dingi ye da sli ado ze baten gogo. Ya ashi di town de kaido de to di nas negi si hot out. A teen go on that jet or the door haven da so tanta needle that erosion. So man that kiss. Ze doesn't know sun ze that's it or the needs now that doesn't take kaido de. Jota panda de to by that each. Say ya doisha dot sit to the no da. Juti nasnigi ya tended kit. Yo pasi ke kuni ke masan ke channel nasta znegi to to nata da needs no ta ya balana da needs and she fini ba fa needs no di ne aro ta hosya kudo ya tegi hanen hiche kunda egi hun khasin bi ya da ke ndish ni aro sa to da is sa da ni ke ni hinna ado o बहुत में हो सकूं अंडा खेदो दो इस आगे बनना चाहिए या पासी दो आश्चर्य ये जो बात है नहीं कि आधा होशियारो इसके दादो ये आरो चांदा है ता ने दी चांदा दे होंडे बिलगान में क्या जो है आधे ते कौन नहीं sabe da na sa is not zago ko that the dog was so that jo ko hoti ko gnaro ke da hotnegi so ada yeah Nancy my sister is in the background and my other sister Helen but all right tell everybody we said hi say hi over here. My sister, she's been taking care of my parents. I haven't even gone home because of the virus for over 6 months now. Appreciate my sister Nancy and my sister Helen taking care of our parents and helping them out and helping out with the ranch. But additionally, Ashwara, Kodon Hachini Kadan, the Nibs Yadas Kyoto, 40 pound and Dani. Hey, ni keni na banda ini. Oh, stop it, zago. Hey, tibe has ani hadet eta beto. No, is sao shi et erosh na. Kuiche. Sala befadesh na. Not ani befadesh na da no da. Ni hiro na hasula go ta nani clean. Ebini na do yadash. Ebe yadash ki ashkon do an hito pa do deini ki anot. So ashir tzo de shlift kudo isha trodo de kudo ishia ho do kwende nesen de chini ni no adon de nanje e ya bir sahnat legi sa akin sa ako ajish masanya do shmado shje ade sahanda le nike kude ande tsada be ande na sande da so yo $1,000 do is ya ho ashkiroshna dan kinaki da is noch sagen do kudo na tani do ku sanda pe kudo shant ko tani dan zinigi so pero here the needle is okay so tagi de zinigi Elizabeth Whitethorn Benali Edo kuna rado do na tani ku Robert do kana rada so Elizabeth ako ichi hansiat skinta Kadoshi Shanto not item Dinigido Punda Craigishi you can't eat never to have something left of it.
Ja, het is eerder zitten, terwijl je dat niet, dat is toch het gaat kaya siya tawagin kahit degi. Ano, Gina to, okay. Census, no, then not out, agi, to banate. Nandito, kasi do, it's do, then in a age, peso banante, higi, esik at, when ye ya, aridan dito, ato, okay, siya tawagin ito, Aprinda Totten Art ya St. Mary's in the Korean in the city to Pashini Payada Hotel kita hazo ya today don't ito ni Payada Hotel ya ya when ye in hand dating when it's a go she has sido de ikiha.
Thank you. All right. Well, we're gonna turn it back over to everybody. Robert's here. Or yeah, come on and say hi. Robert comes out of Shanto as well. Go for it. Introduce yourself and tell us a little bit about what's going on here too.
Yeah, they passing so they like nothing they say Robert Pivot Jr. is the leader. Don't mention it. Dedicated social team, but see.
Hey guys.
On the cheese, something that the pero na shadow. I don't know. What you had a kiss of that, Sasha's league, though, assume that you take it. Alle Chinadi do Inchigi Batani, each had seen on the present door. That's not for the Kodon. So much she did a Gina, they do. Go you grant a call. I go to the Hana Chato. They see the toy in the shake, though they say she things and he adams and he they go to get with the understand. It is also the Daro Head or Dada, Yado, they need to cut. Diego, it did not escape and gave him from Habada on the sun.
42, sure. 42.
They had a sheet, hard seen dark, but they can have some it's not that they had the case. So it is about the hard seen in that say at the end of the car. They want to have a simple and so make sure that they come back here and then they're cautionary measures are taken. So they gave them the yeah, not kidding that other than that you call so yeah, thanks so. What I Hondo, the fans know ya then Yeah, I get a fantastic. Maybe we can go to yellow. I don't know. I let on the never house. But I think we can get overcome it. He though I can't bother on it. No better than eight. Yeah, look at the John. I saw Tondo, Dada, Fiona, Hada. Yes, I don't know. It's chicken is that there's a father. I don't know. I don't know. Funny so then national. I don't know. Yeah, Santa later. I don't know. Santa later. She I thought I been plan is getting kind of later of where I'm I thought the night yes, video specifications in there and I'm so I still get how she again get that long and
All right. Thank you, Robert. Stop. Well said. You know, Robert just mentioned in Navajo, you know, you guys just lessen those family gatherings. I know people are going to start saying, President don't want us to gather with their family now. You know, I know all that rhetoric. But this is for all of us. Is health and well-being. That's why we're doing this. We're not just doing this just to, you know, stop people's freedoms or force people to wear masks. All that conspiracy theory, guys. Put that out to pastor. It is really about the health and well-being of our Navajo people, everybody. We plead with you. We love you. We appreciate the work that you have done thus far. Now's not the time to let up. Let's continue to fight this monster and we'll beat it up. We'll win over COVID-19. So thank you so much. We're in Shanto, Arizona. We'll give it back to the folks back in our nation's capital, Window Rock, Arizona. I believe it's the vice president. Okay, back to you all back in Window Rock. Thank you so much. God bless.
Yananet Shikado Shidne, Shady Perphelia Fowler Dashidne, Ado Ahowado Kashne, Ko, Anita Sato Sunda Isnish, Ado Dina on such it. Hena Kido such it, Sanat Leho Hona Nishne. Yat Hidini dole, Shady my dish gives me slot for the tree, Bashin, Ado Asche Dashichedo, Kappa Eya, Kabahata should say good, as Cheta Shanala, Aya, Stanishle, Ado Totus Aholiene, Ades, Nasha, Ako Benina, Shichito, Suzeto, that is Bali de Ahomado, Ehashne, Johashine, Laponit, Ahomade, Nikichiton, Hinito, that is Bal, the Okonanish, the A, Neot, A, De Nil Nation. Ako hen hidini do les ade seleto shina da hosna egi ade chian de nebetrada ni he yego da hosya ado hashin so kodo salam linido is in the lini ado is it ne kada dan lini ni hito he hashin so na nishpitzili do na nishpitzke da ko shisa zido kodo ba hensen Ado and dash Nashido of Nikito Hehe. Ado Amasana Eche and Nalaga no Sini Maja Nikito and Skag or Hehe Hala Nasko net Nije Nikin Antkin Salaniki Kodo Be Natkin Ado Hashin Sako Nash Ntkina Hashina Holonse Ado Hashino Sa in that Notkin Ado Chini Yajan Danotkin, Ado has Twido Sani das Nido Danotkin, Ado Kodoba Hewinson, Ado not Ani no Senido, Beshmasa An, Ado Tratnas Nille, Ado Kaya Benat Ani no Seni, Ado Hashino Sa Aids and Hesji Benat Ani Bedan Hit Uche, Ado Ultrats a large, Arjito Hashin Soko, not Ani Ke Danel. Anafta iso faiehen hidini dole. Shady ad nebizadi ajo beyashkiko sheshenle. Halan hizadi desnido hashin soko beitki. Dobik et otki hoshe bohitos as. Hashin Sagapoho Ahiki Shin Eya Nahan John do Lekun Sondishne Hajopohos Ato Hajope Yatio Jot Adot Eheda Ado Hashini Tla Eyan Hachina Ani Hikindan Neto do Yastkita Ado Ashan Juno the next Ejita Hatzehe Sasa Opa Chikitlo Ado Apeto Neno Ohut Ada Ochishin or Yesto Jo amano senido ado omaya tata no sini nihi na khasalan la kopanan yoshka yiso a ko khashin sagadi ko awshi yizatan is the kos na khan ni ado hashin sagabij ilya the kos se beat at tata bet no that the kosto job bai they need jin la ko ko hashin ashin bijinte jo hashin sagas twido sani naten ya ta halne ko shin ashin ta ojin ko lashin la hoshin ani da yi zinte jo oho hat edo hashin sagona antini bitini tlen leshik edo shitne a ko di the kosnasni he atinasni shik edo shitne Ado kodos tsilini ita ati izze do bahaleta. Ado hashin sagati vaccine dekne belakanek echuko. Izze bahato le kwaetenen lini sato bento kahanoda. A kopen hichon sha di to benet da o yudan aden shi ebetet ne ko. Do khulakot ya to I see benden dot all kahot hot nida ahoholni sto belakanek atro volunteer desne kwacha jobe ikilta holne ado obe yanta holhize ado hashin sagati kon de nebelcha hot zabaka ido kon da inishiko hashine lam da ejnish dat ejnishido na lishin line kwa Di hashin sago ezedo chinta tes bali bahalodo le ado na nishon neto a leye na nishito a khan date o edo be basalado le ye clean da akas ini saho ye hat ori edo basalado le jo o yugo hashin sago na antkin bullo ako agent da nishito hashin sago behes ani wilyani ito be khatilia Asian Kodo and Lini Dr. Jill Jim Ashi Satoye Yen Hichi Ishan Ido Liso Yen Hichi Hanato Tse Ni Kui Chindo Sat the moda Natle Sa Ben Nata Huilne Konda Hashto it Ado Le the Kui the Shimbechas Nahan Nehon Dapikish Iti Nate yos kasne dan swido sani dan le ala sa de becha atset dan hit ninde kat hashinit adequate de shin ben hit khana atse on da sapik iti ado hashino sa edi behes ani lini bik hanos ihe ado hashino sa behes ani khata de nei oyo pa da tloto to bik hanos inda akonde Ha de shin na de shin bik edet o tin do shot di la benina akwa need la the no sing shin do ado kon is in the business ango is in the hollo khashin so is in the dan lini it's easier in nito it's easy kahi aj khashin so go ye da anni ako is in the di di kwa endol na la di chin da hot no da Ado hashin sugo atrahal nei ko abet da hoye ko haida da hat atet ahota to sto hoye da shikedo shidne ado di de kosnat ni do ba ashadni eda ani lo ya hazedo le hatay elto shido do kont eda nes kashin ashi ani Jo ani do ba ashadni eda bet ado hashine la Bella ashla is twisani tilke jikain lini honi ni hits up bike the hastin a kohashto it adole sad ha honni ni sheet ebe be nasi kato be yat el tio yo ne be tio o tashi be lady kashikedo shidne a koti koto de kui de shi ben hisin ta huilne tsida ani hi need out ya Hashin sakonate I tato kositlido hashine la amma aje anal eche amasanta hashine lago yenan hinestra etanil siso hashine la shin bikit itado distingi be ni so ala ani hot ala nashit nestra na winti do lek et nido lek nanada jo ek akwasani squida da sidli la be de ni nish ako ado tsda ako ejit etanna ha jo ado so kwa na hoti halet de shwal jo hot ada etanna ajdil kido hot ya sato be de shwal sada ya at ehida be khates jo hot ada jo lwat et edo le ado o yugon antkin na te ne sele da hashin soko yego be she ado khoye binda na di na hot gadel ye o yukon nish na loshi da hashin soko na nish de beta nan khadli da etal ne o yukon nish de be ganda andal ne jo khota ego hashin soko non-nation lini do na hot yegon da hot en chende don dan hit en skisen hashine la shin hot an hi da ho akosad ya sad be hat zenda yego be hat zenda ich ketta hat nicht at an le yast hit da nicht shit on ni a konde jo shin la do ben an kinde jo ayo ya hotsana ya anaji di ni ichne hanano ani jobe sa be bichi ya just yot ya a koba da hosyan shikedo shidne jashin sani sweeta sidli inde do at end bohutil ata ati etahwil asa do khashin sako khanna ikna hanna asa o yubeten shlisha zido Jo isen sa dass de queenna die lande en son satan se ich keson ses kesle a kodina tloshi weliene o chon na isna ado hashin saganal tloshi ye bet ado na antkin hullo a konli beyin da hullo de beyin da da ben da hos a jashin ado anda kain hit ni da o yugo bohoto asa ta once lage kwa amma aja che nalada da ni klini ni hito an khasla ado don hit ya da na khalchindo o yuben antino ko at do dei so tsa hot ye bohanet hot ya do ni da no aja do chindo da ha do jo astati no koto hisno tsa do el khata hosnyado joben da hino tienchik do shidene But ya should kodo so nanish lado leto na he da isn't sa do he kodo sa yat hosa be yat ki ado do yat dan hizade jobik edit o ti do hi dan hito ni da sto an hi och da yosna shamasani honni da sa khazado yat ho be yajil kyo an it na yilna Hajon zaden leto hajo beyal ti hajo bey is jo dat an dan tint shikedo shidne ko khashino slashi ati hot aben dan tin he a ko hol sago ni hanana si do di a ho do dishne do ye go ta ho shikedo shidne do na he ko do shin banat and ni hanana si do le Dr. Jill Jim Dr. Jim?
Oh, no, Dr. Fowler and his hananenzi kwedi on his adi. So the abines on the last said the nick et so on nisin kwedi the nebezabe yada it I guess it varies across the regions go for tayo. Asi bayan sun desi. Pin to hanas sa to ashes the nebazade. If get on sa masando so what on to just get neto ba ba hansen so again hit on name seki de shinje ke Dr. Jim a kaya look on so touching ni basis ching do ishin da se che do is a fun da another although not just on that no shadow kaya it's east by yanje kaya big attention do kaya di Health Command Operations Center do kaya COVID-19 response on yani kaya di synonis is so under the Health Command Operations Center kaya kaya di hinanis kaya hanani cha that kaya di clusters had gani kaya tani kaya President Nes kaya hiyan hit hanani zigi do kaya di kuishin hit the nadi the kosan chagi na state at the hagani kaya benada des na no kuishin do asag de at eda a kuishik at en na kaya di shin hit hande sa do kaya ashwanda that di no kaya di atata hasiado a kuichin hat abe hande sa jo ani kaya di azeb tendo kaya di I used to quit and hit the ne quite deep at that snaggy bahan no quite Asian to quite the question sagi yahna has kegi shinto quite the quishin zago quishin that is late the quishin there's about that is late go at the quite but then hate other jo at the rehab holyanida quite which in the high snow at ego at the at least by yonjishing at least dances castle she with beha destin so ado di quality how the nice so at the shelter in place on any quality not so and on the edo quality hit the now what the nice so but the no go quality not so called public health order and not daily ado she di na kitchen da ini so na go in da aja photo kwashi dan his she kwati a kuja kashi di da isam angishi di the neck eto belaganic etici hande so asho da kwati din himasando ni himayas da enishi best da dosne ade belaganic etete hat estin so dishne well, thank you to all the listeners that are on the call this evening. Today, I wanted to do some safety messages and start with the public health order. There are times we get a lot of questions through the command center at the regular phone number at 928-871-7014 is the Health Command Operations number. There are usually calls that also go to the Department of Health, and we're on Public Health Order number 23. So we reissued a stay-at-home order, a shelter-in-place, and a 57-hour weekend lockdown. The purpose of these orders are really to limit mobility around the Navajo Nation due to the increasing cases across the Navajo Nation. There are various clusters that are happening, so we usually provide justification that a lot of these clusters are due to gatherings and also individuals traveling off the reservation. It's very important that we follow these public health orders because as we experienced in May, we had a surge that was at its highest. I mean, there were days where we were over 100 cases, and we don't want to experience that. We did a really good job at one point, and so a lot of this is to not overwhelm the healthcare system, but also to mitigate those. We were asking to make these preventive measures. I'm also in my own office here, not with anybody else, so I'm not wearing my mask right now. And then I think there were calls coming in regarding the time. So if you look at the time here, the weekend lockdown starts on Friday at 8 p.m. The daily curfews start at 9 p.m. I noticed that those that are receiving the daily notifications from the Division of Person or the Emergency Management Office, I think what you're getting is the that the daily curfew is 8 p.m., which it isn't. The 8 p.m. doesn't really start until Friday until Monday. So for this 57-hour lockdown, so there's the 1 hour difference from your daily curfew. Basically, CDC's recommendation is staying home is the best way to protect yourself and others from getting sick. The more closely you interact with others and the longer that interaction, the higher the risk of COVID-19 spread. So these are the recommendations from CDC that we're incorporating into the public health orders. And during the shelter in place, all essential services or activities are allowed. Individuals may leave their place of residence only for emergencies or to perform essential activities, primarily includes activities essential to health, safety, and welfare. And also that visitors are required to refrain from traveling to the Navajo Nation at this time. According to the CDC, staying home is the best way to protect yourself. Also, during the shelter in place, the daily curfew is 9 p.m. to 5 a.m. And I think that's where all the confusion is coming. So make sure you read their public health orders, and that's when the weekend lockdown starts at 8 p.m. to 5 a.m. on Monday. And the individuals are still permitted to cultivate farming, to tend to livestock, however, plan ahead to purchase hay and food. Individuals are not required to remain indoors during the weekend lockdown. Outdoor activity is encouraged, and individuals may leave their immediate residence or home site for exercise, such as running or hiking, so as long as movement is restricted to no more than 5 miles from one's home. Essential businesses, including all stores, gas stations, restaurants, and drive-through establishments shall be closed during the weekend lockdown. Hay and all vendors must cease operations during the weekend. These closure and cease operations requirement does not apply to healthcare operations, essential government functions, essential infrastructure, or food cultivation. So essential employees reporting to during the weekend lockdown must carry a letter of designation, wear a mask properly in public, avoid public gatherings of no more than 5 people, maintain social distancing, and remain in your vehicle for curbside services and drive-through essential activities. So those are essential businesses are required to all of these measures of limiting customers and opening between 6 a.m. to 8 p.m. Non-essential businesses shall remain closed until 8 a.m. on Tuesday, September 29th. So I think this gives some further clarifications. We haven't been in a weekend lockdown or a shelter in place for a very long time, and we were getting a lot of questions regarding what does that mean. So this is just a reminder to kind of remember the different areas of the lockdown as well. So I'm going to go ahead and share some preventive messaging that I would like to continue to give everybody. So what I'm going to do is change my screen to a different presentation. This presentation is usually done. I try to do these so we can continue to receive regular messages, as Dr. Fowler mentioned, that you wear your mask, maintain 6 feet of physical distance, wash your hands with soap and water for 20 seconds, and clean and disinfect high-touch surfaces. There's always the question when to interact with individuals that that might have thought they had COVID. So when it's safe to be around others after you had or likely had COVID, there are always questions like, when can I be around others, or when can I visit someone that had COVID? And so these are some basic recommendations. So at least 10 days since symptoms first appeared, at least 24 hours since last fever without a fever-reducing medication, and any symptoms have improved. So if you think you had COVID and had symptoms and you tested positive, you also tested positive, but you had no symptoms, which we also refer to as asymptomatic. So if you continue to have no symptoms, you can be around others after 10 days and have passed since 10 days have passed since tests, and also you continue to have no symptoms. For anyone who has been around a person with COVID-19, it really depends on the time frame. Sometimes we recommend that if you've been someone around that is COVID positive for 15 minutes or more in less than 6 feet, I like to say 3 feet, with that person in an enclosed space or just somewhere with 15 minutes or longer, you're probably considered a close contact where you need to quarantine. It's important to quarantine for 14 days after exposure based on the time it takes to develop the illness. So that's usually around 2 to 14 days. So just stay home if you think you have been around someone who has tested or has COVID or that you didn't know. So also it's important to maintain the 14 days, even though you might not feel any symptoms and you feel okay. It's better to just not go out of your home or do other things and increasing your risk if you might get symptoms after 10 days, 11, 12 days, 12 days. So avoid large gatherings. So the more people you interact with at large gatherings, especially when flea markets are not allowed right now, ceremonies, family celebrations, in-person church services, and others are types of large gatherings that are not really happening right now, but you might be in that situation, even though I think there was a lot of individuals. We were very lax during this last couple of weeks as our numbers were decreasing and were very low. So the longer the interaction lasts, the higher risk of becoming infected and spreading COVID-19. So to stay safe, you need to avoid large gatherings, protect our elders and people with underlying health conditions by wearing a mask and staying at least 6 feet apart. Wash your hands often with soap and water for at least 20 seconds. Frequently clean and disinfect high-touch surfaces and objects. Discourage handshaking and hugs. Also avoid sharing with food. Avoid food sharing with people you do not live with. Celebrate with a phone or a video call instead. And other areas that increase your risk, as indicated, is that if you are celebrating and gathering together indoors, it's probably you're more at risk. If you bring multiple households together, in some of our exposures, we've noticed that there are multiple households that are being infected or were together in these large gatherings. And once you leave a gathering, when you have multiple households, you actually spread the disease even more when you go back to your other households that you're in those isolated situations. Also, sharing food is also not recommended. The duration of gathering is also what was mentioned earlier, the longer you interact, and also, and that could be either if you are gathering for hours versus 2 hours or 1 hour, or if you do a drive-through gathering, such as a birthday gathering, and that's going to be less risky than a half-a-day gathering with people in multiple households. And just an example is if you're using one towel in a restroom as well, that is a very high risk of spreading COVID. So just as an example, when you are at a gathering and you're only using one towel at a restroom. Other ways to gather safely is virtually meet. Also, family social group on social media. You can do that. Mail letters and pictures, family online box, and playing online video games with family members are one way to gather safely. Also, with food and safety and COVID-19, right now there's no evidence to support the transmission of COVID-19 associated with food. So it may be possible that a person can get COVID by touching a surface or object that has the virus on it and then touching their mouth and nose or eyes. So it is possible, but just to make sure that when you're out and about getting your food, before preparing or eating food, it's essential to always wash your hands with soap and water, and for 20 seconds, keep raw meat separate from other foods, refrigerate perishable foods, cook meat to the right temperature, wear a mask while ordering food at a restaurant, dine outdoors if possible, and then also wash and sanitize your hands after blowing your nose, coughing, sneezing, or going to the restroom. Around this time, we also heard a lot of individuals talking about wood hauling during the COVID-19 pandemic as well. So staying physically active or being outdoors is one of the best ways to keep your mind, body, and healthy as well. But in many areas, people will be wood hauling and preparing for the winter. And right now, we did hear of some cases where households are coming together to wood haul, and also have been some exposures regarding that. So just know that these recommendations that we provide sometimes are based on real situations. So just know that we wouldn't be talking about these recommendations if they didn't happen. So they do happen, and that's why we have to bring this message to you guys to inform you guys that it's very important that we still implement the very basic preventive measures in any kind of setting. And that means wood hauling for the winter. So visit open areas that you are familiar with, avoid crowded areas, wear a face mask, maintain at least 6 feet of physical distance from others, clean and disinfect snacks, tools, ice chests, and all items you take. Take water to keep hydrated, wash your hands with soap and water for at least 20 seconds when you get home. Use a hand sanitizer if needed. Keep the forest clean by not littering. Monitor children at all times and only haul wood with people you live with. And so that's the last important message I indicated was the wood hauling. If you are not wood hauling with people that you live with, you have to take all the precautions regarding making sure you have gloves, you wear a mask, even though that's your own family member from a different household. And family gatherings of this sort, or any family gatherings, is still a caution that we still all have to make. And then we have traditional ceremonies. During the pandemic, we have to recommend remote prayers and ceremonies, no large gatherings in closed areas, limit 5 or fewer people, and do not attend if you are sick. Do not attend if you are exposed to COVID-19. So if you feel like you're a close contact that need to be under quarantine, or either if you are feeling sick, meaning you have a fever, you have runny nose, you have a sore throat, you're coughing, you feel nauseous, you have muscle aches, those are just some things that you need to consider. That right now the flu is probably starting to happen. We have the flu, we have people that might have stomach flu. There are other types of illnesses that are around. So anytime you just feel sick, period, do not be around other individuals. Use a shade house or hogan home with windows and doors open. Everyone must wear a face mask. Do not hug or shake hands. Avoid sharing objects. Some of our previous exposures, what we're encouraging is that these recommendations were already made available. I think I've been mentioning it every other week. So if you have not seen these, they are on the Navajo Department of Health webpage. So avoid sharing objects such as tobacco, smoking pipes, drinking cups, utensils, or food. Bring individual water in closed containers. Prepare your own supply of medicine, herbs, and pollen. Avoid sharing medicine, herbs, and bundles. Clean and disinfect all objects used. Wash your hands after or use a hand sanitizer. Eat meals while seated more than 6 feet apart, and avoid having children at the ceremony. The same with the sweat lodge. We did have sweat lodge exposures as well. So just as a reminder that one person in a sweat lodge at a time. Avoid sharing items. Bring individual water containers. Bring your own supply of medicine and herbs, pollen. Do not insert hands in another person's medicine bag. Wear a mask. Bring your own towel to sit on and use. Also have someone outside for any assistance. Ventilate air out of the sweat lodge for at least 24 hours and reuse, remove, and hang fabric, door, floor coverings in direct sunlight. Clean and disinfect other items. So thank you for adhering to those recommendations if you are. And just as a precaution for disinfectant safety, injecting or drinking bleach, Lysol, or other disinfectants does not treat COVID. Read the label. If it includes methanol, do not put it on your skin or drink it. Follow the label instructions. Do not mix chemicals. Make sure it's out of reach of children. And if it does get swallowed or injected, call the poison hotline, helpline, which is 1-800-222-12222. And lastly, I just want to show that during this pandemic, as we're dealing with grief, or not even just with grief, I think just experiencing COVID in general, either it could be related to job loss, financial anxiety, loss of safety, worried about loved ones, feeling of loneliness, changes in daily life, special plans and event cancellations, clashes with family members over how to protect yourself, worries about how to pay rent, utilities, and other bills, sadness of how the pandemic changed the world, fears for future. Those are all very important things that we experience and maybe not really share. I know that we are always worried about all of this during this pandemic. It's been a long, drawn-out process. It's something that we never expected, and it's something that we're dealing with, and we have to cope with it until we figure out how to live in a world with no COVID. So practice self-care, give yourself time to heal, reach out to family members, find support, take care of your body by taking deep breaths. Stretching or meditating are very important. You can always call the Navajo Regional Behavioral Health Center at 505-368-1438 or 505-368-1467 Monday through Friday, and they're also available on weekends. In the Tinley area, it's 928-551-1713. Dilcon and Tuba City, it's 928-551-0624. Farmington, Kirkland, and Shiprock, 928-551-0508. Shiprock and Red Mesa region, 928-551-0394. And then as a last reminder, we do have a 57-hour weekend lockdown this weekend. As I mentioned, it starts at 8 p.m. on Friday and ends on Monday at 5 a.m. The daily curfews are still 9 p.m. to 5 a.m. every day. So I just want to thank all the listeners for joining this evening. And just as a reminder, practice hand washing safely for 20 seconds. Also continue to wear your mask in public. Also wear them properly. Make sure it covers your complete mouth and nose, as well as making sure that you're practicing physical distancing as you are out and about. And also prepare for the 57th weekend lockdown. It's really up to us. It's our own responsibility for ourselves and also others around us, our families, our relatives, and the whole Navajo Nation. We really did a lot in putting the numbers down and decreasing the trajectory of cases over time. And so we're capable of doing that. But they need us. So I know that we can have hope. And I always like that when President and everyone else says, "Hata'inofna," and there is hope. This is only temporary for the weekend. And it's a way that we can just spend time with our family to reflect on all of these teachings that are given to us every day by our leaders, by Dr. Fowler, everyone. Those are all valuable teachings. As they iterate to us, our grandparents and our grandmothers have told us every day to practice these, being resilient, we can persevere in this, and those are all words that on the Lagana side, I guess those are words that we can instill in our kids and we can learn from that. So that's a lot. Another term that I really like is it's really up to us. And in doing this, it's our own responsibility. And Ashin Hitanit El de Yastot. So if you had non kidit ni don non daisonos angi do, if you had non do, Kashin E Aniki. Have a good evening, everyone. Thank you.